A hazardous manual task is a manual task that involves any or a combination of the following: repetitive or sustained force, high or sudden force, repetitive movement, sustained or awkward posture, and exposure to vibration. These factors create stress on the body that can lead to musculoskeletal disorders, which are the most common cause of workplace injuries in Australian workplaces. Musculoskeletal disorders, MSDs, are injuries to or diseases of the musculoskeletal system that can occur suddenly or over time. These conditions may involve chronic pain and can include sprains and strains of muscles, ligaments and tendons, back injuries, including damage to the muscles, tendons, ligaments, spinal discs, nerves, joints and bones, joint and bone injuries or degeneration, nerve injuries or compression, muscular and vascular disorders as a result of hand-arm vibration, soft tissue hernias, and chronic pain. In the national harmonised legislation, the term does not include injuries or diseases caused by crushing, entrapment or cutting resulting from the mechanical operation of plant or other equipment. Let's take a closer look at some injuries that have occurred to workers performing manual tasks. Click on each of the buttons to learn more about how different parts of the musculoskeletal system can be injured. This worker has a damaged spinal disc. Spinal discs support the weight of the upper body. Over time, general wear and tear can cause small tears in the disc fibers, weakening the outer layers of the disc. Incorrect postures and activities like lifting can cause the disc to bulge out or rupture, putting pressure on nerves in the spine and causing pain. A ruptured spinal disc can be a chronic, long-term and painful condition. This worker has a strained muscle. Muscles are made up of thousands of individual muscle fibers and are attached to the bones by tendons. Loads that are excessive, sudden, repeated, or held for a long period of time can cause these fibers to tear, which is known as muscle strain. Strains can cause pain, swelling and stiffness, and reduce your ability to move and handle objects. Severe strains can result in a complete tear in the muscle tissue, which may require surgery. This worker has a sprained ankle ligament. Ligaments are the fibrous tissue that joins bones to other bones to form joints. The fibers of ligaments can be torn when placed under excessive, sudden, repeated, or sustained loads. Tears to ligament fibers are known as sprains. Sprains can cause pain, swelling, and stiffness. Severe sprains may require surgery. This worker has damaged the nerves in their wrists. Nerves are bundles of fibers that transmit messages and impulses from the brain to other parts of the body, such as the muscles. Swollen muscles or tendons or ruptured spinal discs can place pressure on nerves, causing damage. Damage to nerves can cause pain and numbness, and severe damage may require surgery. Injuries to the spine that result from manual tasks are not limited to the spinal discs. The spine consists of many different structures, including bones, nerves, ligaments and muscles, which can be injured while performing manual tasks, and are at greater risk of damage from hazardous manual tasks. The spine forms an S-shaped curve, and this shape should be maintained when performing manual tasks. Three of the spine's main regions are the neck or cervical spine, the upper back or thoracic spine, and the lower back or lumbar spine. The lumbar spine is the main load-bearing area of the spine and is the most vulnerable to injury when performing hazardous manual tasks. When you use your muscles to perform a movement or task, the amount of effort used can be described as force. The application of force can overload muscles, tendons, joints and spinal discs, and cause musculoskeletal disorders. Let's take a look at some different ways force is applied when performing hazardous manual tasks. Click on each person to learn more about each type of force. Repetitive force is the repeated use of force to move or support an object over a period of time, such as when stacking items on a pallet or gripping and handling bricks. Sustained force is the continual application of force over a period of time, such as when pushing a trolley or carrying an object over a long distance, or holding down a trigger to operate a power tool. High force refers to any task that a worker describes as very physically demanding or that requires help due to the effort required. It also refers to tasks that require a stronger person or two people. Examples could include pushing or pulling an object that is hard to stop. High force may be exerted by the back, arm or leg muscles, or by the hands and fingers. Sudden force refers to sudden applications of force, such as jerky or unexpected movement while handling an item or load. These movements are particularly hazardous, as they require the body to adapt suddenly to changing applications of force, such as carrying an unstable load, such as a bagged stock feed that suddenly moves, or a patient who suddenly resists. Applying force suddenly with speed also generates high force. The use of the body to apply force can cause damage gradually or suddenly. Gradual wear and tear can result from activities requiring the application of force over time, such as bending and twisting or maintaining a sustained posture. Rapid damage can be caused by sudden movements or the sudden application of a high amount of force. Injuries can also be caused when force is applied suddenly using a part of the body that has been weakened through gradual wear and tear. This is how even a low amount of force or exertion can lead to a painful injury. Posture refers to the position of your body parts in relation to each other. Good posture means that when working at a desk, your head and torso are upright and facing forwards. Your arms are beside your body. Your forearms hang straight or at right angles to your upper arm, and your hand is in the open position, which is also known as the handshake position. However, it is not recommended to maintain one posture for long periods of time. Poor posture is a common cause of back pain. Awkward postures are those that require you to position your body in a way that is uncomfortable or unnatural, such as when you are reaching above your head to perform a task. Sustained postures are those that require you to hold your body in a particular posture over a period of time. The muscles are held in a tense position without interruption, which restricts blood flow. Let's take a look at how a sustained posture can cause muscle pain and injury. When we are active, the blood flow to our muscles provides oxygen and nutrients, while also removing waste produced by exerting our muscles. However, if we exert our muscles while not moving, our blood flow is reduced, which reduces the supply of oxygen and nutrients and allows acids and waste to build up. This means that it is more difficult for muscle tissue to recover, which over time can lead to muscle fatigue and injury. Some manual tasks can involve exposure to vibration. The two main types of vibration exposure are whole body vibration and hand-arm vibration. Whole body vibration is caused when vibration is transmitted through the whole body by machinery or a vehicle. It can lead to damage to bones and joints, particularly in the lower spine. Hand-arm vibration occurs when the vibration is localized in the hand and arm, such as when using handheld power tools. Hand-arm vibration can cause damage to nerves, muscles, and joints. Some serious hand-arm vibration injuries may be untreatable. Under the National Harmonized Work Health and Safety legislation, a person conducting a business or undertaking, PCBU, such as an employer, has a primary duty of care to take reasonably practicable steps to maintain health and safety. This duty includes the provision of a safe work environment, safe systems of work, and information, training, instruction and supervision. Employers in jurisdictions that have not adopted the harmonised legislation have similar duties. You should check with an appropriate authority if you need to know more. As a worker, you also have work health and safety responsibilities. Work health and safety legislation requires all workers to take reasonable care of their own health and safety, take reasonable care that their acts or omissions do not adversely affect the health and safety of others, and comply with any reasonable instructions, policies or procedures provided by their employer or other PCBU in relation to health and safety at work. The national harmonised legislation also includes a legal requirement for PCBUs and workers to work together to reduce risks in the workplace, such as those presented by manual tasks. You should now have a good understanding of what types of activities are considered to be hazardous manual tasks and the types of injuries these tasks can cause. Before we move on, you'll need to complete a short multiple choice assessment. You'll need to pass this assessment to complete the course.